Hi guys, welcome to video blog number 1. And this is in keeping with the promise that I made, most especially to all of my fellow post-mastectomy pain syndrome sisters out there that I know and love. I'm going to be blogging about a couple of different subjects. First of all, I'm going to be blogging about having complex regional pain syndrome type 2, which I'm sure you've never really heard of. So I should probably start by telling you what it is. Basically, it is a neuroinflammatory disease, and what it does to the body is not so great of things. It's been classified as a rare disease by the National Institute of Health and also by the United States FDA as well. There are approximately 200,000 cases that are diagnosed per year in the United States. Of those, 7% are type 2, which is me. So I like to be a rare bird, I guess. So they say. Anyway, unfortunately, right now the disease doesn't have a cure, and it is progressive. It can affect the human body in a lot of different ways. It can alter something as simple as your voice, or it can affect your internal organs, cause muscle atrophy, muscle contractures, or things of that nature. What we do also know about it is, in accordance with the American Medical Association and National Institute of Health guidelines using the McGill Pain Scale, that CRPS is the most painful disease known to modern medicine. And it's not new. It was actually discovered during the Civil War era. But then, for whatever reason, research never continued, and because it is so rare, with little amount of people being diagnosed, not many dollars go there for research. When you have a big deal disease, like I had breast cancer, there's lots of research out there. But when you try to look for research on CRPS, it's a lot harder to find. And unfortunately, the majority of the best research that I've personally found either comes from overseas or from far away in the United States where treatment is too far out of reach. For some people, treatment is completely out of reach, and that's a horror all unto itself. This is a disease that is more painful than every known cancer or even giving birth naturally. Yet, there are people out there that, if they're lucky, at best, can get ibuprofen to try and help them with their pain. Try and imagine treating bone cancer or giving birth with ibuprofen. Probably wouldn't give you a whole lot of support, would it? So we who have it have to develop a lot of skills on how we handle our pain. And those of my friends who also, like me, have post-mastectomy pain syndrome fall under that same category. We're all dealing with horrible pain that was the result in my particular group's instance of breast cancer and breast cancer surgery. Nobody knows why it happens to some and why it doesn't happen to others. We do know that it affects women far more than it affects men. And don't forget that men can get breast cancer too. 1 out of 100,000 men will get breast cancer. And unfortunately, it's not talked about enough. If you have a man in your life that you love, your dad, your son, your husband, your friend, make sure they're checking their pecs, because they got breasts. They don't have milk ducts, but they got breasts. And we want to keep those guys around, right? We need to find a cure for that too. But let's get back to talking about pain. Pain is a horrible thing. It can steal from you a lot. It can steal a lot from your life and being able to do things that you want to do or go places that you want to go. So you have to learn to deal with it in a lot of different ways, and you have to look and be open-minded to treatments. And sometimes that can be really, really hard. So I think I'm going to start this blog by saying it was really hard for me to make the choice to agree to this last treatment option that's available for me, and that is a ketamine infusion. It is a medication that is strong and one that I have had some very negative experiences with in the past that literally have terrified me. And it is definitely not something that is an easy decision to make. But the decision was pretty much take this infusion or nothing at all. At this point, sticking me with more needles and doing more blocks or more ablations actually risks more spreading of the disease. The recent breast biopsy from the recent breast cancer scare on my right chest wall unfortunately was confirmed by my specialist to cause a spreading of the CRPS into my right chest. So the entirety of my torso, both of my arms, my hands, my shoulders, part of my back are 100% affected by the CRPS and the PMPS. I've got a tram flap reconstruction that didn't quite heal so great either, so that's obviously throwing a little bit of a mess in the mix. And I should note that there is a genetic component to my diagnosis. I have what's called MTHFR. It's a polymorphism in your DNA. There's a lot that doctors can do for you with genetics. Genetics doctors can help you with changing your diet or adding certain supplements or doing certain treatments with you that are geared towards your genetic structure to try and help with any genetic impairments that you may have. In my case, what I have actually increases my risk factors for, go figure, cancer. So it's no wonder that I've had cancer twice, and that I developed post-mastectomy pain syndrome and subsequently have contracted complex regional pain syndrome type 2. So we got to deal with it from here. There's different kinds of treatments that they use for this, and sometimes those treatments are hard choices, like using opioids, narcotics, or what I'm about to embark on, this ketamine treatment. There are other people that are using things like low-dose LDN treatments, if you have access, hyperbaric oxygen treatments, but all those treatments basically are geared towards helping the symptom as much as possible. You have to make a tough choice, and for me it was a really, really hard choice because I pride myself on how I've controlled my diseases and learned to deal with them without using opioids and narcotics as a dependency. I also have some things wrong with my internal nerves and my phrenic nerve and my diaphragm. So for me, opioids and narcotics can actually be a risk to my life. So it's more important that we keep them away from me. So I got to look for more alternatives. This ketamine treatment was something that I was keeping on the back burner. I've known about it for months. I've seen the doctor before. It was something we were considering, but I hadn't really put a push for it. And I kind of had it in the back of my mind because of the kind of the nature of the drug that it is. I thought it would be better for me if I stuck to getting radio frequency ablations and various types of blocks. The doctor, unfortunately, does not agree, and he's got a lot to go on. The biopsy was in a very invasive needle, and that's what caused the spreading. We're hoping that if we treat me with the ketamine as quickly as possible, we'll be able to reverse the spreading that's happened on my right side and better control the disease. Right now, what we can do is control. What we can't do is cure. I need your help for that. If you're watching this and you're somebody that wants to support a cause that people aren't paying attention to, please pay attention to what some refer to as reflex sympathetic dystrophy, RSD. You can learn more about that on the rsds.org website, which is the United States website for as much information as possible. There's a lot of other things that you use, a lot of tools in the toolbox. I use things like braces, kinesio tape, heat, meditation. We have a plan to use more physical therapy, desensitization, pool therapy, and learning different ways of doing even mindfulness and meditation, and learning how to change the way your brain receives pain signals, basically. It takes a lot of work and a lot of practice. It's not something you do overnight, but it's definitely worth the effort. But along with that comes listening to the specialists, listening to your loved ones, and accepting the treatments that are available to you despite what risks they may come. My big fear with them is these medications can sometimes make the body physically addicted. And that's something that I don't ever want to experience. But I've learned that having a physiological addiction to a medication in order to control a disease is better than allowing the disease to run rampant or not having greater quality of life to spend with your loved ones. Because remember, whatever you decide also affects the people that love and care about you all around you. And I kind of learned that lesson the hard way, and I'm hoping to save you that problem. So I'm going to keep blogging, and when we get closer to the date, right now it's November, it's prior to Turkey Day, so those of you who celebrate, gobble gobble. Hope you have a good one. I will be starting my journey with this new treatment in December, and you can look for more blogs to come, both in type and in video. And I hope to be able to be a voice and an example to dare to try, because being vulnerable is actually being courageous. So jump into the arena with me. Let's go for a ride.